So Charlene had her basic toxin treatment 2 weeks ago, which we treated the forehead, frown and eyes. It's coming back for a review visit. So we always name it a review visit. We don't call it a top-up visit because they expect a top-up. So on the review visit, 1, we're going to see if there's any top-ups required. 2, where is required to inject. And number 3, how many units we need to give. So if you want to raise your eyebrows, Charlene. So perfect. There's minimal, very few faint lines, just relax. Very few faint lines, but nothing that we don't. Because remember, with toxin treatments, we're not getting rid of the movement, we're just softening the lines. So we definitely don't need to do anything in the forehead. If you want to frown, so you can see a bit more of a bulge with the procervis. So we definitely need to give 1 there, and relax, and frown. And we can see a bit in the corrugator as well. So Charlene was actually a horizontal frown. So the horizontal frown, the procervis is more dominant. So it was 25, 5. Because it's been more than 50% improvement, we're going to half the dose. So we would give 10, 2.5, 2.5. So original dose was 20, 5, 5. Today we're going to do 10, 2.5, 2.5 there. So remember, if it's more than 50% improvement, half the dose. If it's less than 50% improvement, repeat the same dose. So then next we're going to look at the eyes. So if you just want to turn to your left and squeeze your eyes closed, see very minimal, probably could get away with 1 marking there, and relax. So Charlene was a combo smiler, which was 4, 4, 2. So it's definitely more than 50% improvement. So we would give 1 unit on this side there. If you just want to look straight ahead. So we can see forehead, we don't need to give anything. Glabella we do, but we're going to half the dose where required, so we 10, 2.5, 2.5. If it was a vertical frown where we did 10, 10, 10, and we want to half the dose, it'd be 5, 5, 5, and then there's 1 there, and obviously we'll have a look at the other side in a minute. So generally speaking, 1, do they need a top-up? Number 2, where will you inject? And number 3, how many units will you give?